First, welcome to our all-member webinar. This webinar is being recorded for distribution to our members, and the idea here is if you have other things happening in your life, or you're exercising, or you're cooking, or any number of things, and you want to listen in later, you can at your own convenience. And we intend to do that for our future webinars as well. I'm going to go ahead and click on to the next slide. I want to give a shout out before I get into this webinar to a couple of our board members who happen to be joining us. So we have Janet Mikulski, who is the chair of the NAC board, and she's with Pfizer, and she's on the line. And then we actually have 3 new members of our board of directors: Lakeland Hogan, who is with Home Instead Senior Care; Regina Shee, who's with the Rand Corporation; and James Appleby, who's at the Gerontological Society of America. So a digital round of applause for our new, yay, our new board members and the wonderful leadership of the NAC board. I also want to give a shout out to Scott Williams, who is also on our board of directors and is on the line today as well. Scott has been on the board for a couple of years, and he is also a huge champion of the work that's being done globally to advance caregiving, as well as a champion within his individual organization in making EMD Serrano a more caregiver-friendly workplace. So Scott, thank you for joining as well. So Karen, I'm going to hand it over to you to do our mission moment, which is something we started at our board of directors meetings to just remind us why we do the work that we do and why we partner with wonderful champions like all of you in doing this work.
Thank you, Grace. Good afternoon, everyone. And thanks for giving me a moment to share this little glimpse at how caregivers manage.
Karen, are you still there?
Yes. Can you hear me now?
Okay. Yes.
Thanks there. As I was saying, good afternoon, everyone. To start off our webinar today, we just wanted to take a moment to think about what family caregivers go through and how our work helps them continue carrying out these roles. As family caregiving is associated with various burdens as well as rewards. Caregiving has been associated with terms that you may have heard of, like compassion fatigue or caregiver burnout. And these terms essentially refer to the state of experiencing physical or mental exhaustion or cumulative burnout. And these states have been observed in healthcare and emergency and community response workers, as well as the family caregivers that we work with. Helping these caregivers and their families experience better outcomes can also at times seem daunting for people like us who are trying to advance programs and policies and systems that help them perform their roles to the most effective way they can for their families. However, now is a good time for us to remember that we can look at the people that we're hoping to serve for some inspiration. Specifically, people who are championing for caregivers can draw some inspiration from some specific tools and strategies that caregivers use for resilience. These tools are available to caregivers via the services and supports that we actually help at in advance. I'd like to share a very simple and effective tool with you today. It's called a Signal Breath. It comes from an evidence-based program that was developed by researchers at the University of California, Berkeley, but it's been incorporated into a number of evidence-based and evidence-informed caregiver programs, like resources for enhancing Alzheimer's caregiver health, which is Rose and Carter Institute. There's also a version that's offered by the Veterans Affairs caregiver program. So to guide you through this very quick and effective exercise, because that's what caregivers need, something that's quick and effective and fits into their lifestyle so they can get back to the business of the caregiving roles that are so important to their families. Take a comfortable seat and place your feet on the ground. If you have hands on the desk. If not, place them on your lap. And try not to look at the at the PowerPoint slide in front of you. So you may want to take your gaze down or even close your eyes so that you can listen to some of the extra cues that I'm going to give you. Just know that you can come back later and look at these directions if you want. We want to begin by rating our level of tension. So using the following scale: 1, being not stressed at all; 2, 3, and 4, your stress is building; and 5, feeling extremely stressed. Rate the level of tension that you feel. What tension do you feel in your body? What tension do you feel mentally? What tension do you feel in your breath? Now think of a common word or phrase, something like peace, or I am relaxed, or I am calm, anything you choose. Don't overthink it, just choose something quick and easy. And now take a deep yet comfortable breath through your nose. Pause there and hold it briefly, and then breathe out slowly through your mouth. Try this again, taking that deep yet comfortable breath through your nose. And now as you breathe out, quietly or silently repeat the calming word that you chose. And we'll try this again. Take a deep yet comfortable breath through your nose. Pause briefly, and then breathe out slowly through your mouth, repeating your phrase and letting your jaw, your shoulders, and your arms go loose. Now try this on your own one more time. And when you're done, rate your level of tension again, going back to that scale that we mentioned from 1 to 5. Notice if your stress level changed. If it was low, did it go higher? If it was somewhat high, did it go lower? And just keep in mind that everyone's nervous system is different, and stress management exercises have different effects on different people. However, research has shown that this particular exercise is beneficial for dementia caregivers in particular. Some caregivers who were given an exercise based on the meditation from which this exercise was derived had significantly reduced depression scores after 6 weeks compared to caregivers in another group who didn't receive the same intervention. But know that you can change it. You can take slower breaths. You can make gestures with your fingers. You can keep your eyes open. You can keep them closed to help yourself feel more at ease while you're using this exercise. And remember that it's something that you can come back and revisit at any time, especially in times like this where the urge and the compelling need to help others can really take a toll on people who are involved in the types of work that we are.
Over to Mike Wiki, who is the Senior Director of Public Policy and Advocacy at NAC, and he's going to talk a little bit about caregiving and COVID-19. So Mike, please take it away.
Hi, everybody. Thanks for being on today. Like everybody else, we're trying to figure out, trying to scramble and figure out how we can best contribute to, easing the situation around COVID-19. Especially as it relates to caregivers. We know they're pretty, heavily, impacted by this, especially if they're caring for people who have compromised immune systems or a little bit older. So there's a couple of different areas where we're trying to get involved. One is we worked with Caring Across Generations on a tip sheet for sandwich generation caregivers specifically. And that tip sheet should have just come into your email boxes, probably maybe like a half hour ago. Create a letter that's going to be led by and put out under the banner of the Rosalind Carter Institute that will have some language around how, the caregiving community in general will react to this. This isn't something that we're trying to put out, roughshod. We want to make sure we're working through it. So there's some back and forth going on in editing right now. And we're hoping to get something together by the end of the week. So keep that in mind and stay posted for that. And then in another area, there's a lot happening on the legislative side around relief for people affected by COVID-19. So we're really trying to track what happens in that language and how it can have an impact on family caregivers and older adults especially. There are 3 different areas in the House bill that came to mind specifically that we're trying to follow into the Senate and ultimately into law, and see, do a sort of a longer term analysis on how this plays into the larger landscape as it relates to caregiver policy on the federal level. But there is some language that was in the House bill around emergency paid leave benefits for caregivers. That's actually the only provision that specifically mentions caregivers, but there are provisions around paid sick days for families who have been affected by the outbreak. And there is some language in the House bill around providing some additional funding for nutritional support through the Older Americans Act. So those are a few things that were top of mind through the House bill that we were looking at, and that we're going to be tracking and into law, and sort of beyond that, to see ultimately how this shapes into support for caregivers and where we can improve on what was missed through this opportunity that's moving quickly. It seems like there are a lot of gaps as it relates to paid leave that can be built on and improved on. And I know that specifically Senator Gillibrand and Representative DeLauro, in probably less than an hour, are going to be making a statement on a bill that they're putting out that is supposed to be addressing some of the gaps that they see in the paid leave provisions in the bill that's being worked through the Senate right now. So those are a couple of the areas that we're working in, and trying to follow beyond, not just right now, but where this moves in the future. I know that I see some chat coming up, and I know there are a lot of people who are following this issue who have other areas that they're following too. So I wanted to just take a look here. I see a comment from Marcy Phillips saying that some of them are putting and National Family Caregiver Support Program language into an LCAO later. So thank you, Marcy, for putting comment about that on there. Okay, so I think that's basically my update for the COVID-19 report right now. So I'll stop there, Grace.
So Lakeland Hogan asked, can we share the tip sheet out to our networks? Absolutely. Mike, thank you so much for walking us through that. We appreciate it. What are the interesting or critical problems that need to be solved in order for us to move caregiving forward? As our board expands and diversifies, they will be undergoing a strategic planning process. But for the immediate short term, this is the general direction that we have identified as what we're doing and why we're doing it. So the first goal is about building momentum for a national caregiving movement that will empower families across a lifespan. And I know many of you may be saying, we're already in a national movement, but this is really about that idea of how do we take this amazing unpaid workforce, these 44 million Americans, and really get them to coalesce around some shared and common goals that would allow this movement to really not just continue to be a buildup of momentum, but really move things forward in terms of improving quality of life for individual caregivers and the people they care for. The second piece of this is recognizing that caregivers are stretched thin, and it's not fair to really make all the caregivers raise their hands and say, please, please, please include me. And so rather than putting the burden on the caregiver to really get access to services or supports or information, the second goal is about creating system-wide pathways for caregivers. So allowing providers and others who are providing support to caregivers to develop a way that we can invite them in rather than having to have the caregiver stand outside the door and keep knocking. It's also a goal that works on identifying the unique contribution that a caregiver can make on a care team. So rather than thinking of caregivers as just an extension of an older adult or a person with a disability, the caregivers are a unique part of the care team, much like professional clinical providers, much like occupational therapists, physical therapists, and so on. And then finally, our third goal is about bringing us into alignment with global best practice and really thinking about advocating for the caregiver as their own unique person with a right to self-determination. And this could be anything from thinking about whether caregivers have the right to decline, to even engage in caregiving, to examining how we can recognize and support the work that caregivers are doing. So with that background, the questions that are keeping us up at night. So the first one is really getting consensus on how we define the term caregiver, what the need is, and what the solution should be. So if you think about movements like HIV, the Americans with Disabilities Act movement, marriage equality, there was, in general, consensus around the key levers that needed to be pushed in order to improve lives for the communities in those situations. In caregiving, we have a lack of consensus on the research side of the scope of the problem, on who qualifies as a caregiver and what the solutions might be. And this is an excerpt from a report that was done by the Institute of Medicine, now known as the National Academies of Sciences, Engineering, and Medicine, that just looked at elder caregiving and noted that even just in elder caregiving, we're working off of different assumptions. You may also have seen estimates of prevalence anywhere between 17.5 million Americans who are caregiving, all the way up to 90 million people. And so one of the charges that I see we can tackle as a community is really thinking about how we get to consensus on who it is that needs help, what their need is, and what solutions are out there. The second is really understanding these different silos of care. And being a huge musical theater nerd, I think of this as sort of West Side Story, and you have the Sharks over here and the Jets over here, and you have a number of supports for caregivers that are by virtue of the beneficiary. So for example, the Medicaid Home and Community-Based Services Program is really to support a Medicaid beneficiary, even though that beneficiary can choose to have a caregiver provide care and get reimbursed. On the other side, you have the social care paradigm, programs like the Older Americans Act, which say we think caregivers are really important, and we don't really care who the beneficiary is. We know by just generally supporting caregivers, we will improve overall population health. And then some programs, such as the VA Caregiver Program, or many of the programs run by the patient advocacy groups who are on the call today, are hybrids. They have some things that are just for caregivers and their unique needs, and some pieces of the program that are just to help the caregiver better provide care to the individual who needs care. The third big question that's been gnawing at me is understanding access and how access and identity work together. So the graph you're seeing here is from a literature review that came out a couple of years ago, looking at caregiver identity. And one of the things that the literature review said is that a lot of people resist identifying because they feel like it may take over other roles in their life. And what I would say is when we look at this, this research, when we look at the research we've done on caregiving and choice, and when we look at communities of color or even our partners in other nations, it becomes really clear that asking people to self-identify has some downsides that may prevent people from getting the help that they need. You have folks that think caregiving is just an assumed part of their family role. You have communities where their societal expectation is such that you would never not think about being a caregiver. And you have a psychological impact of changing your relationship to the person you're caring for. So you're no longer spouse or sister or daughter, but now you are the caregiver. And what does that mean for your fundamental relationship? So that's an area where I think so many of our programs require either explicit self-identification or just the way we communicate about them by calling them the caregiver such and such, makes it difficult for families to really get the help they need. And so that's a huge area that I think we have more work to do as a community. Number 4 is understanding shared decision-making. Now, this is a graph from the work we've been doing in patient-focused drug development. And what we're charting here is that the person with dementia and their caregiver, they're playing slightly different roles. So there are moments where the voice of the patient is going to be much louder, and they're really driving what the care plan looks like. And there are moments when the caregiver moves from being an observer to a reporter, and even to being a proxy or standing in the shoes of the patient. And we see these dynamics play out in different ways in pediatric conditions, in adult conditions, particularly chronic disease where that may relapse and remit. And what's not clear is when we look at regulations, whether it's for a clinical trial or a care setting under Medicare, it's not always clear where the person's needs and voice stops and the caregiver's voice picks up. And so that's an opportunity for us to really help define what that balance looks like. And finally, I think the big picture is thinking about how do we strengthen family units and promote resilience. And this is a conversation that's been ongoing. I'm pulling here from a beautiful documentary called The Weight of Honor. It follows a number of families who are caring for a veteran. And one of the things that struck me when I first saw this film last year was what happened to these families after this long caregiving experience. And more than half of the families that are followed in the film ended up estranged from the person who was caring for them. I know a lot of you who are working in oncology or cancer, you may see this where you have families where someone has cancer and they come out and they're okay, and now they've moved into survivorship and they no longer want to be the person who needs care, and so they cut off contact with the person who was caring for them. And we see that in a number of areas. In this example, Scott, the caregiver, the veteran who was profiled in this movie, he was injured in Iraq. His mom moved across the country and left her job to care for him. But as he became more independent in his recovery, they became estranged. And then he got married, and his wife left her job to care for him. And so when you look at these types of patterns, it begs the question, what are we doing, not just in the short term to care for caregivers, but in the long term to improve the resilience of these family units and to allow families to thrive despite disease or disability. So this gets to how can you engage with us in tackling some of these big questions. And I'm going to hand things over to Gabriella Prudencio, who is the Hunt Research Director. This is an inaugural position that was named after our founder, Gail Gibson Hunt. And one of the things that we're doing is we think about working more effectively with all of you and the great work you're doing is thinking about what strengths we have within this body of experts. And so she's going to talk a little bit about what we're doing on the research side and the work that's been done to date. So Gabriella, I'm going to hand it back over to you.
Thank you, everyone. So I'm here to tell you about our research collaborative, which started only last November. And it's a collaboration of researchers, and also we have policy professionals and healthcare professionals across various disciplines on family caregiving and who are working across the lifespan. And the purpose is to share and build on each other's knowledge so that we can improve the quality of life of caregivers. We do these, we have three different objectives. One is to increase sharing of knowledge and perspectives among researchers. The other one is to increase collaboration between both researchers across the lifespan, but also the users of this research, recognizing that many times this collaboration is not happening. And lastly is to generate an environment and a culture where we can enable this knowledge sharing across researchers and across policy professionals and across healthcare professionals. So our activities, we are looking at regular webinars. So our last webinar was in late January, but I look forward to starting again in April with a more structured discussion on various topics about caregiving. Then we also have opportunities to collaborate on specific projects. For example, recently a number of researchers from the collaborative who are interested in the issue of assessment just submitted an abstract to GSA to present this in their November conference on the issue of assessments and family caregiving. We are looking at an annual in-person convening this December, and by all means, anyone who wants to come, please do contact me. Last November's convening was really rich and people came out with a lot of substance. And then last but not least, we are developing a platform, an electronic platform where we can share files, where we can start discussions. It's basically where we can host collaboration.
Okay, I'm handing it back over to Mike. Mike's going to talk a little bit about the work of the Advocacy Collaborative.
Thanks, Grace. Yeah, so we have recently launched what we're calling our Advocacy Collaborative, and this is actually an evolution from a group that we had previously been running for the past several years of state and local coalitions that were sort of an informal network of people who were working to support caregivers on the local level, either through information and training type of activities or through advocacy on the state level. We have decided to bring that state and local group together with some of our partners on the national level. So what we did is we started by launching the group to include, like I said, the members of our state and local coalitions and the national coalitions that we're members of. So there are several different coalitions that we belong to, ranging from issues related to aging, to disability, to paid leave, or all the different types of areas of focus that touch on family caregiving, to make sure that we not only are able to provide a voice in those coalitions, but also that we're able to get these sectors to work together who sometimes don't have a place to collaborate. So technically the collaboration is an interdisciplinary network of people who are focused on policy and practice issues related to caregivers of any age or caring for any type of condition, background, things like that. So as we launched, we started by outlining the type of work we were going to be doing together and creating a charter. So we just finalized our charter, and in the charter we have put the goals that we're going to be working on. We have identified these goals in terms of short range, medium range, and long-term goals. So in the short term, on the state side, we're working on what's called a 50-state strategy. And this is supposed to be sort of a complement to what the Raised Family Caregivers Act is working on. But what's unique about this project is there are several states who have already created their own task forces to come together to create recommendations for caregivers specifically. And that's similar to how the Raised Family Caregivers Act Advisory Council is formed. And so what we're doing is we're going into these states that currently have these state plans, and we're looking at where those recommendations are in terms of implementation. Have any of those plans recommendations been implemented? Is there a current process to implement any of the recommendations, or are the recommendations that just aren't moving anywhere, and why would they not be moving anywhere? So that's what we're going to be producing in the short term, is sort of an analysis of those different state plans and how states can learn from one another to build on successes where they have been found in other states. The next thing we're doing is we're working to support the Raised Family Caregivers Advisory Council and the work that goes along around that. So there is two pieces to that. One, we worked through the Older Americans Act reauthorization to get an extension of the Raised Family Caregivers Act because it was about to expire. It's pretty close to expiring in like the next year or so. And they are just now in the process of forming their goals. So it needs more time to be able to do what it's going to do. And a year really isn't sufficient, but at least we're able to get that in that package. So that's one thing. And another thing that we're doing is we're working to support any of the work that the NASHB, the National Academy for State Health Policy Resource Center, is doing. They have a partnership with the Johnny Hartford Foundation and ACL to support the Raised Family Caregivers Advisory Council. So we're looking for ways that we can most effectively engage there, and we're going to be working on some vignettes that hopefully we'll be able to include in that work somehow. So stay tuned on that. That's more of a medium range goal. And more long term, we're looking at how you can really expand the national support infrastructure to be inclusive of all caregivers across the lifespan. And that doesn't necessarily mean one central program, one size fits all, but we're looking at how different systems and different government agencies and the private sector can even work together to expand services to caregivers who currently aren't eligible for services where they need them, and how they might best be crafted. It's kind of like a patchwork that we're working on developing, and this is really a long range goal. One of the things that we're doing most immediately in that space is looking at how you can look at caregiving through a public health lens, and where the public health sector can be expanding or improving their infrastructure to more effectively support caregivers where they currently exist within those systems. Again, it kind of goes back to that notion that Grace mentioned earlier about really connecting the social service systems and the healthcare system, and how caregivers fit in between those two worlds. So you can get involved in this work in a number of different ways. Our door is always open to you for any one-on-one interaction about the work that we're doing, how we got involved in it, or where we plan to take it in the future. You're always welcome to join any of our monthly meetings. They happen on the third Thursday of the month at 4 p.m. Eastern time. And if you would like to be included in those meetings and aren't currently on our roster, then just shoot me an email or Karen. My email is mike@caregiving.org, and Karen's is right there on the screen, Karen@caregiving.org. We're really excited to have Health and Aging Policy Fellow Lisa O'Neill work with us this year, who's who's helping us lead these collaborative meetings, and is really kind of helping us think through a strategy for growth with this collaborative. And then finally, we're going to be doing an annual meeting on Capitol Hill, which will be kind of the first event of its kind. And that should be taking place later in late summer, early fall. Obviously, things are pretty up in the air right now with how public gatherings are going to be looking in the future. So we're trying to be mindful about that.
The last collaborative. So this is the Pathways Collaborative, and this comes out of some of our work in innovation. And the purpose of this group, which we've had some task forces that some of you have already been engaged in, but this group is sort of an outgrowth of that. So the idea here is, how do we define regulatory pathways to enable medical product developers, healthcare providers, and social service providers to better integrate the caregiver into shared decision-making processes during the process of care delivery? And if you're like, oh, what a mouthful, I will say the shorthand that we've been thinking about is this really falls in two buckets. How do we define the role of the caregiver in the medical product development process? And that's work that we're doing with the FDA. We provided comments back to the Energy and Commerce Committee last fall when they identified caregiving as an area of key importance for the Cures 2.0 legislation. And we've also provided public comments to the FDA on their patient engagement guidance and how we see caregivers fitting into this process. Next up for that FDA-related work is creating talking points that can be used by our industry partners and other trade associations to really look at how caregiving might fit into the upcoming PDUFA reauthorization, which, if those of you who are not nerds like me, PDUFA is the Prescription Drug User Fee Act, and there's a suite of UFAs, and these are the bills that essentially help pay for the regulatory review process at the FDA, and notably requires that sponsors who are creating medicines or devices pay some fee into the federal government to help cover the cost of that review. And wrapped into that legislation is this movement towards patient engagement and patient-focused drug development. So our charge is to think about, we know caregivers are already part of this process, so can we define that and really recognize those unique contributions? Later this year, we will also take the frameworks like the one that you saw earlier today that had the voice of the person with dementia and their caregiver. And what we're going to be doing is creating a short publication that has multiple frameworks and some of the regulatory pieces of that. So for example, in dementia, CMS has a guidance that says if you're caring for someone with late-stage dementia, the caregiver can complete the PHQ-9 depression assessment on their behalf. And frankly, that's just wacky because that depression screening tool has a number of really subjective questions. Do you feel worthless? Have you felt suicidal? And you can imagine if you're caring for someone with late-stage dementia, how difficult it would be for you to be able to really respond as if you were that person. So those are the types of things we're hoping to highlight, either where there are levers that would help us provide better support to caregivers, or where there are pitfalls that maybe we should be reconsidering as a community. We're also working on a short guidebook, and I have to give a shout out to AGS and their great publication, Geriatrics at Your Fingertips. So same idea, sort of a caregiving at your fingertips, a brief publication that summarizes the existing billing codes that allow a service provider to get reimbursement for services provided to caregivers. And it's a strange area because the caregiver is not typically also the beneficiary. And so it's something that we're looking at, and we had an initial meeting in December, but we'll be doing follow-up work this spring with the idea of having a publication available at the end of the year. That we love to hear from you, and we love to be able to share your information with our network and in our weekly newsletter, This Week in Caregiving. So thank you so much, and have a wonderful rest of your week. Stay safe, be well, and take care.